Welcome to Cosmetic Networks Live, where we explore the aesthetic and the cosmetic industry from the inside out. Hi, I'm your host, Sheila Maitland, and this is Friday, June 27th, 2014, episode 101. Our special guest today is Dr. G, board-certified plastic surgeon from San Diego. Welcome, Dr. G.
Thank you, Sheila, for having me.
Oh, we're so glad to have you on the show. We have some great topics, but I first want to start with, what inspired you to be a plastic surgeon?
Wow, that's such a great question because it really gets at the core of who I am as a person, so I always love answering it. And I would have to say that I've always known I wanted to be a surgeon from the time I was a little kid. Just one of those things that I can't explain. And to the point where I would always be wanting to dissect things. I'd steal chicken hearts from my mom in the kitchen and take them down to the basement and cut them up and look inside. And as I evolved through my education, of course, things became a little more sophisticated for me, and I got into medical school and was fortunate to work under Dr. Milton Edgerton, who's one of the godfathers of plastic surgery in the 20th century, modern plastic surgery. And it was so inspirational to work with him at the University of Virginia that by the time I got into my surgery residency, I just decided to go that route and become a plastic surgeon. And I think for me, it just embodies all the things I'm interested in. It's a great mix of aesthetic artistry, things like balance and proportion and symmetry and contours and all of those things that artists themselves are concerned with. And yet it's very analytical and scientific. I have an undergraduate degree in math, so I've kind of got an analytical mind too. But this way I get to sort of satisfy both of those things inside of me.
Well, then you took it to the next level. You went from just being a plastic surgeon to being a board-certified plastic surgeon. So what is the importance behind that?
Well, you'll hear that term a lot, and thankfully you'll hear it more and more lately these days as the importance of board certification becomes recognized. But essentially there are specialty boards that give certificates or a credential for all specialists. So pulmonologists and infectious disease specialists and plastic surgeons all sit for their board examinations. And it's a special process beyond the residency training whereby they evaluate us with both written and oral examinations. And it's a pretty grueling process, at least for us in plastic surgery, and we can't even qualify to sit for our boards until we've been in practice for 2 years. And once we satisfy the minimum requirements of the board, then we're granted the certificate to become board certified.
So then once you get that board certification, is there any type of maintenance that you have to do to go back and to continue that certification?
Well, that's an excellent question, and this is sort of a hot topic right now in the medical community because all of the specialties are now gravitating toward a process called maintenance of certification or recertification, but really maintenance of certification is the more appropriate term. And every so often with plastic surgeons, it's every 10 years, we have to go through a process whereby the board looks at our practice, they look at our professional character, and then we also take an examination to test our knowledge and make sure that we're keeping up with the current technology and current science in plastic surgery. The one thing I would like to say about maintenance of certification is that not all board certified plastic surgeons maintain their certification. Right now it's a voluntary thing on the part of the board. And because there were surgeons at some point that were granted a lifetime certificate, and those surgeons have the option whether or not to maintain their certification, whereas surgeons who got their board certification after the year 1995 have to enroll in the maintenance of certification program.
Wow, that is some important information. I suspect that a patient might want to ask their physician or their practice before they go into surgery. I mean, if it's been years before a physician has kept up on their maintenance, that might be a little bit of a red flag.
Well, I personally think so. I may be biased because I was one of those surgeons that came after 1995, but I will say that that notwithstanding, I still think maintenance of certification is a good idea because of what you're saying. You know, to give a lifetime certificate way back at the beginning of one's career, then they don't ever have to have any kind of review of their professionalism or their knowledge base. I don't think is the best way for practicing medicine. So I think that the overall concept of maintenance of certification is a good one. And as if this whole board certification thing wasn't confusing enough for people, you know, I'm sorry to throw another thing in the mix, but I think it's an important thing to check, as you said, not only ask if their surgeon is board certified, and not just board certified, but board certified in the specialty to do the procedure that they're requesting of them, but to make sure they've maintained their certification.